Did you know that a symptom as common as constant fatigue could be a sign of something more serious? Vitamin B12 deficiency affects millions of people around the world, and surprisingly, most have no idea that they are facing this silent problem. Imagine what it would be like to discover that unexplained fatigue, those strange tingling sensations, or those sudden mood swings are not just part of your routine, but the warning that your body is asking for help. Think about it for a moment. Have you been feeling a lack of energy, weakness, or even difficulty concentrating lately? If so, it could be more than just stress or a bad day. Today we'll talk about how these seemingly harmless symptoms could be linked to a deficiency in vitamin B12, a vital nutrient that not only boosts our energy, but also plays a crucial role in our neurological and emotional health. Welcome to Health. Now, the channel where preventive health is our priority. I am Dr. Garcia, a doctor specialized in taking care of your well-being before problems become complications. My mission is to bring you clear, practical, evidence-based information to help you live a healthier and fuller life. In this video, we'll explore the main symptoms of vitamin B12 deficiency, how to identify it in its earliest stages, and what steps you can take to prevent serious complications. We'll discuss which groups are most at risk, how to diagnose this condition, and the best ways to maintain your B12 levels optimal, whether through diet or supplementation. So, stay until the end, because I will share with you essential tips to keep your health under control and prevent this deficiency from affecting your quality of life. Also, don't forget to subscribe to Health Now and activate the bell so you don't miss valuable content like this. Now that we know the importance of paying attention to our body, let's delve into what exactly vitamin B12 is and why it plays such a fundamental role in our health. Vitamin B12 is one of the most important nutrients for the proper functioning of the human body. Although we often hear about its importance, many people do not fully understand the fundamental role it plays in our health. This compound, also known as cobalamin, is crucial for vital processes such as the formation of red blood cells, maintenance of the nervous system, and energy production. In the nervous system, vitamin B12 acts as a key protector, helping to preserve myelin, the layer that covers and protects nerve fibers. A deficiency in B12 can cause alterations in nerve conduction, which in the long term can translate into symptoms such as tingling or numbness in the extremities. In addition, this vitamin is essential for synthesizing DNA, making it an indispensable element for cell regeneration. The most common sources of vitamin B12 come from animal foods, such as lean meats, fish, eggs, and dairy products. This is because the vitamin is not produced directly by plants or animals, but by microorganisms present in the soil and in the intestines of animals, from which we obtain this nutrient through their meat and derivatives. For people following vegetarian or vegan diets, it is important to seek out alternatives such as B12 fortified foods or take supplements to avoid deficiencies. Although the amounts needed are small, their impact on our health is immense. Understanding why we need vitamin B12 is the first step to appreciating its importance. In the next chapter, we will discuss the initial symptoms that may indicate a deficiency of this nutrient and how to detect them in time. Vitamin B12 deficiency can start silently, with signs that we often overlook or attribute to stress and the fast pace of life. However, these early symptoms are an alert from our body that we should not ignore. One of the most common signs is persistent fatigue. If you feel tiredness that doesn't go away even after resting, it could be a sign that your body isn't producing enough red blood cells due to a lack of B12. This can also lead to muscle weakness, as your muscles aren't getting the oxygen they need to function properly. Vitamin B12 deficiency can also manifest itself in the form of dizziness or lightheadedness, especially when you stand up quickly. Additionally, some people may notice changes in their appetite, such as a lack of interest in food, which could further worsen the nutritional deficiency. For example, Maria, a 45-year-old teacher, ignored these symptoms for months, thinking they were just part of the exhaustion of her daily routine. However, over time, she began to notice memory problems that affected her performance at work. After a medical checkup, she discovered that the cause was a vitamin B12 deficiency, something that was completely preventable. Identifying these signs early can make all the difference. In the next chapter, we'll explore the neurological and emotional symptoms that can arise if this deficiency is not treated in time. If vitamin B12 deficiency is not detected in time, it can seriously affect the nervous system and emotional well-being. These symptoms are often more subtle at first, but over time they can become debilitating, impacting the quality of life of those who experience them. A common symptom is tingling, or numbness in the extremities, especially the hands and feet. This occurs due to progressive nerve damage caused by a lack of myelin, a protective substance that depends on vitamin B12. The pins and needles sensation may be intermittent at first, but if left untreated, it can evolve into more serious problems such as difficulty coordinating movements or maintaining balance. On a cognitive level, many people with B12 deficiency experience difficulty concentrating or remembering simple things, which is often mistaken for normal aging or even stress. However, these problems can be reversible if the deficiency is treated in time. As for the emotional impact, mood swings, irritability, and depression are common. This is because vitamin B12 influences the production of neurotransmitters such as serotonin, which are responsible for regulating mood. Unfortunately, many people believe that these symptoms are only related to their environment or lifestyle and do not seek medical attention. It is important to pay attention to these signs and seek help if they persist. In the next chapter, we will explore which groups are most vulnerable to this deficiency and why they should be especially alert to these signs. Vitamin B12 deficiency does not affect everyone equally. Certain groups of people are more prone to developing it due to dietary, health, or age-related factors. Identifying whether you fall into one of these groups can help you take preventative measures and protect your well-being. People who follow vegetarian or vegan diets are one of the most vulnerable groups, as the main sources of vitamin B12 come from animal foods, such as meat, fish, eggs, and dairy products. Although some plant foods are fortified with B12, those who completely avoid animal products should consider supplementation to avoid deficiencies. Older adults are also at higher risk. As we age, the body's ability to absorb vitamin B12 declines, in part due to reduced production of gastric acid, which is needed to release B12 from food. In addition, common conditions such as atrophic gastritis can exacerbate this problem. Another vulnerable group includes people with intestinal absorption problems, such as those who suffer from celiac disease, Crohn's disease, or who have undergone bariatric surgery. These conditions make it difficult for the body to process and absorb the vitamin effectively. Pregnant and breastfeeding women who are vegan or vegetarian should also take special care, as B12 reserves are essential for the healthy development of the baby. Knowing who is at risk is crucial to preventing complications. In the next chapter, we'll look at how early diagnosis can make a difference and what tests are essential to detect a vitamin B12 deficiency. Identifying a vitamin B12 deficiency early is crucial to preventing serious complications. Fortunately, there are simple tests that can provide a clear picture of your levels of this vitamin in your body. The first step is to perform a blood test that measures serum vitamin B12 levels. Normal values are generally considered to be between 200 and 900 pg/ml, but even if they are within this range, some people may experience deficiency symptoms. That's why it's important to discuss the results with a doctor, who may also order additional tests, such as measuring homocysteine and methylmalonic acid, MMA. These markers are often elevated in cases of early deficiency, even when B12 levels appear normal. In addition, your doctor may perform a clinical evaluation based on your symptoms and medical history. This includes inquiring about your diet, lifestyle habits, and possible risk factors, such as digestive problems or previous surgeries. A key recommendation is to include this analysis as part of your annual medical checkup, especially if you belong to a risk group. Ordering this test can be a simple but decisive step in identifying the deficiency before it causes more serious problems. With a clear diagnosis, the next step is to implement practical solutions. In the next chapter, we will explore which vitamin B12-rich foods you can include in your diet to maintain healthy levels naturally. One of the most effective ways to maintain healthy levels of vitamin B12 is through a balanced diet that includes foods rich in this essential nutrient. Fortunately, many options are within reach and can be adapted to different lifestyles and dietary preferences. Among the best natural sources of vitamin B12 are lean meats, such as chicken and beef, as well as fish, especially salmon, tuna, and trout. These foods not only provide B12, but also high-quality proteins that contribute to a balanced diet. Eggs and dairy products, such as cheese and yogurt, are other convenient and versatile options that you can easily incorporate into your daily diet. For those following a vegetarian or vegan diet, alternatives include fortified foods, such as breakfast cereals, plant-based milks, and enriched nutritional yeast. These products are specifically designed to provide vitamin B12 effectively. An easy way to integrate this nutrient is through practical recipes. For example, a breakfast rich in B12 can include scrambled eggs with spinach and a little grated cheese, accompanied by a glass of fortified milk or a fruit smoothie with yogurt. It is a quick, nutritious, and delicious option. With a proper diet, it is possible to prevent deficiencies. In the next chapter, we will discuss supplementation, when it is necessary, and how to implement it safely. Although a balanced diet can help maintain healthy levels of vitamin B12, in some cases, supplementation becomes an essential tool to prevent and treat deficiencies. This is especially important for those who have difficulty getting enough B12 through food or absorbing it properly. Vitamin B12 supplementation is available in several forms, including capsules, sublingual tablets, nasal sprays, and, in more severe cases, intramuscular injections. The latter are particularly useful for people with severe absorption problems, as they allow the vitamin to enter the bloodstream directly, bypassing the digestive system. Groups that might benefit most from supplementation include older people, vegetarians and vegans, individuals with digestive issues such as gastritis or Crohn's disease, and those who have undergone bariatric surgery. Additionally, pregnant and breastfeeding women on vegan diets should ensure that their supplementation covers both their needs and those of their baby. It is important to remember that although B12 supplementation is safe and generally well tolerated, it should be done under the supervision of a physician. This ensures that the dosage is appropriate for your specific needs and that there are no interactions with other medications. With the support of a B12-rich diet and appropriate supplementation, when necessary, it is possible to maintain optimal levels. In the next chapter, we will explore practical strategies to prevent long-term deficiency and take care of your health in a holistic way. Preventing vitamin B12 deficiency is easier than it seems, and with small changes in your lifestyle, you can protect your health in the long term. The key is a combination of a balanced diet, healthy habits, and regular medical checkups. A balanced diet that includes foods rich in B12, such as meats, fish, eggs, and dairy, is the first step to maintaining adequate levels. If you follow a vegan or vegetarian diet, be sure to incorporate fortified foods and consider supplementation under the guidance of a physician. Planning your meals with variety and making sure you meet your nutritional needs is essential. In addition to diet, regular medical checkups are essential. Including B12 testing as part of your annual checkups will allow you to detect any deficiencies early. This is especially important if you belong to a risk group, such as older people or those with digestive problems. Maintaining a healthy lifestyle can also make a difference. Regular physical activity, getting enough sleep, and managing stress all contribute to improving overall health and optimizing nutrient absorption. A practical tip is to include a colorful plate in your main meals with proteins, vegetables, and healthy carbohydrates. This not only ensures nutritional variety, but also a balanced supply of essential vitamins. With these simple strategies, you can significantly reduce your risk of deficiency and enjoy optimal health. In the next chapter, we will recap the key points and close this journey with a special invitation to take care of your well-being. Vitamin B12 deficiency may seem like a minor problem at first, but as we've seen, it can have a significant impact on our health if not detected and treated early. Throughout this journey, we've explored the most common symptoms, from fatigue and tingling to emotional and cognitive changes. We've also learned who is most at risk and how to identify this deficiency through medical testing. It is important to remember that prevention is the best tool to protect our health. Maintaining a balanced diet that includes foods rich in vitamin B12, or, in the case of vegetarians or vegans, opting for fortified alternatives and adequate supplementation, is key to avoiding complications. In addition, regular medical checkups are an essential practice to identify any deficiency before it causes serious problems. We have also talked about how vitamin B12 is essential for the proper functioning of our nervous system, the production of red blood cells, and daily energy. By taking care of our B12 levels, we not only prevent annoying symptoms, but also ensure a better quality of life. Taking care of our health doesn't have to be complicated. Small actions, such as planning a varied diet and consulting a doctor if any symptoms arise, can make a difference. If you found this information useful, I invite you to take action right now. Subscribe to the channel Health Now to continue learning about wellness and prevention topics. Give this video a thumbs up and share it with friends and family who can benefit from these tips. Remember to also explore the recommended videos that will appear on the screen to continue learning about how to improve your quality of life. Every small change you make today is a step towards a healthier future. Thank you for joining me on this journey towards knowledge and prevention. I am Dr. Garcia, and I look forward to seeing you in the next video to continue building a healthier life together. Until next time.